Hello to our favorite listeners and viewers, and welcome back once again to another wonderful episode of Fit and Fabulous. I remain your host Ajayi Adenike, and this is the Ordained Radio TV Gospel Ministry, where we bring you the end time news, the undiluted Word of God, trending health gist, talks and discussions on love, relationship and marriage. And you are back once again to another episode. Of course, I told you the last time that we're bringing in a health practitioner that's going to discuss hypertension series, and I told you the last time that you should get your blood pressure checked. I hope you did. So today we are moving on and progressing on this wonderful episode, and of course, like I said and promised, we are here on the doctor's desk with the health practitioner, and it is with great pleasure I introduce to you a doctor in the building, in person of Dr. Oladapo.
Yeah, thank you so much. It's really nice to be here. My name is Dr. Oladapo Adetunji, actually. And my basic training is a pharmacist, but I'm also a public health enthusiast, with a lot of experience in public health and community health. So it's really, really nice to be here to share my own views with respect to hypertension.
It's a pleasure to have you, and we are all glad that you are discussing this with us. So he's going to be discussing the medication and lifestyle management of hypertension and side effects. And please go along with us, take notes, come with your pen and paper and biro, and please drop your questions in the comment section. They will all be attended to at the end of the series. So let's start. So you have the floor, sir.
Yeah, so managing hypertension, requires it's a multifaceted approach that requires you to understand some basic things. But when you're trying to manage it, we want to help the patient with respect to the diets. We want to help the patient to monitor the kind of lifestyle he or she is living. And then before we now go to the pharmacological aspect, which involves the use of the medications, and lifestyle modification. And I want to say that kudos to you for laying a very good foundation in the previous series prior to now. So I'm going to be skipping quite a lot of things. I'm going to refer the audience to that series. Make sure you watch it. Lifestyle modifications, include regular physical exercise. Regular physical exercise helps to keep the heart running properly. And what do I mean by regular physical exercise? Exemplified by brisk walking, not just anyhow, walking or jogging. And people think if you walk rather than jog, you are not going to have that expected, issues. But of course, walking briskly is also one of it. If you are able to do this for about 30 minutes within the day, I think that is sufficient enough. Then also we talk of weight management. Having to manage weight, looking at what the BMI is. Weight has to do with the height, the age, and of course those are some of the factors we look at. Another thing with respect to lifestyle management is reduction of stress. Every single thing you do, make sure you are not stressed out. If you're hypertensive and you are adding stress to it, it's a big issue, it's a big problem. Then we also talk about sleep management as part of the lifestyle management protocols in managing hypertension. What number of hours of sleep do you have in a day? It is prescribed, or rather it's expected that you don't have less than about 6 hours of sleep, good quality sleep in a day. Once you have things interrupting your sleep, those are signs that you need to get to the medical practitioner and get yourself checked up. Now for dietary issues, one thing we usually emphasize is to reduce as much sodium intake as possible. Sodium intake exemplified in our own community by a lot of salt. Some people believe that if the food is not salty enough, then it's not sweet. That is not true. All those things add, to the tension that is already high. So it's believed that you take less than about 2,300 milligrams of sodium intake per day. That's just fine. Potassium-rich foods that are going to supply sufficient potassium to you, like green leafy vegetables, bananas, sweet potatoes, those are things that should be part of a person's diet as much as you can. And there are some other fruits too that are good in that. Then apart from that also, you want to ensure, if you're hypertensive, that you eat whole grains, you eat lots. I mentioned vegetables the other time, and then you eat what we call lean protein. Permit me to use this word in our own local dialect here in Nigeria. They call it a gemawo. That if you don't have all the innards, the gizzards, the kidneys and all of that, you are not enjoying life. But all those things actually, cause the build-up of some unnecessary protein that you don't want within, your system. And then the gift of life that the Almighty God has given unto us is water. You need to drink plenty of water. Get yourself properly hydrated. And that is, those are in a snapshot some of the lifestyle management, that we want to, before we go to the pharmacological interventions. Now, with respect to the pharmacological interventions, medications that are used in managing, not curing, because hypertension has to be managed. A lot of people, probably when we start taking the question series, a lot of people have the opinion that this hypertension thing, can it not be totally eradicated? From the medical point of view, no, but it can be well managed and well controlled. One of the medications is what we call diuretics. Those ones work, diuretics work by ensuring that you have a lot of water outflow from your body, and as a result, sodium is removed gradually from the body. Examples include furosemide and torsemide. Then we have what we call the beta blockers. The beta blockers, they slow down the heart rate and they reduce, the blood pressure as a result of that. And in that category, we have drugs like propranolol and atenolol. Those are. Then we also have what we call angiotensin converting enzyme inhibitors. Now, God has made angiotensin within our system, but even though it has some peculiar functions it does, you don't want it to be, over function. And that's why you want to limit, the conversion of that angiotensin into something else that is going to cause an increase in blood pressure. Because by the time you block the formation of angiotensin 2, then there's a reduction in the vascular pressure, which ultimately also leads to a reduction in the tension within the blood vessels. And captopril and enalapril are just examples. Then we also have what we call the calcium channel blockers. And what they do is they reduce alpha-1 adrenoceptors. Those alpha-1 adrenoceptors are part of the receptors that hypertension causing molecules they bind to. And examples of medications in this category include prazosin and doxazosin. And then finally, we have what we call the ARBs, the angiotensin receptor blockers. Remember, I talked about angiotensin the other time. Yes. If you're unable to stop it from being converted, then you have to stop it from binding to the receptor. And that's what the ARBs do. They don't want the angiotensin to bind to the receptors at all. And you have losartan, telmisartan, and valsartan. So in a snapshot, those are the 5 classifications generally, that hypertensive patients are usually placed on. And some people may think, once in a while, we get in touch with patients that say, well, when I check my blood pressure and the thing has gone down, I stop my medication. No. It's a lifelong management thing. It's not something that is eradicated. But just as I said the other time, it's something that can be well controlled and well managed. So the usual thing we tell people is you do your regular blood pressure check. Probably you get your own device. You're going to be taught how to use it, and then you follow up on the appointments, of your medical, your medical practitioners, the medical doctors. They are there. They are specialists that are trained in handling hypertension. Don't miss your clinic date for whatever reason. Even if you're not going to go, get in touch with your physician that for this reason I might not be able to make it to clinic this day, probably the physician will just say, okay, fine, what we did the last time, you can just continue it until you come and see me. But for as much as possible, try not to miss your clinic date. Then the additional considerations is for people that take alcohol, for people that smoke, it is time for you to gradually move yourself away, from that kind of lifestyle. Smoking and excessive alcohol intake, they are things that contribute to complications for hypertensive patients. And of course, there are some other things which we call underlying medical conditions. Most of the time, when a person is hypertensive, what you want to prevent is end organ damage, because there are so many organs, that could get damaged once hypertension is not taken care of or controlled or managed properly. So I think in a snapshot, those are some of the things we want to, re-echo and echo again with respect to managing hypertension.
Thank you so much. I have been taking notes and I'm sure you have too. So before we continue, go to the side effects of hypertension. If you're watching us live right now on Facebook, you can also watch us on our YouTube at The Ordained Radio, and link would also be pasted in the post below. And also on YouTube, you can watch us on Facebook at The Ordained Radio TV. And you can also listen in on our radio website at www.ordainedradio.com.ng. And please subscribe to our YouTube channel and follow us on Facebook. Then I have a question, but I'm going to be leaving my questions to the end of the series. So please, all your questions and everything you want to voice out concerning managing hypertension, please drop them in the comment section. We will be in the comment section, and at the end of this series, we are going to go over all those questions and treat them. So very quickly, sir, to the side effects of hypertension.
Now, the side effects of hypertension, we're going to look at it from the medical angle. Most of the side effects that people have reported in time past have been linked to the, abuse in quotes of their medications. There's nothing that doesn't have side effects. Even water, when you overuse water, it's going to have side effects.
Yes.
But most of the side effects that people talk about, insomnia, that's lack of sleep, is one of the side effects based on the use of some medications. I'm not going to go through the medications now, but generally lack of sleep is one of them. Then some people have reported cases of increase in the rate at which they urinate, as one of the side effects of the medications they take. Then some people talk about nausea and vomiting. Fortunately, these side effects are not generalized. It is on individual basis, and that's why it's good for you anytime you go visit your physician, you let your physician know these are the effects, these are the experiences I'm having. It's important that you don't keep anything back, and then one other side effect is reduction in libido, which causes people to stay away from their medications. But just as I said, it's on a one-on-one basis. What physicians do, those of us that try also to manage hypertensive patients, is to help them overcome some of those side effects. You could give some other medications that will not negatively interfere with the main medication of the hypertensive treatment or therapy, but at the same time take care of some of those side effects. For example, some diuretics, when you use them in the evening, definitely the person's sleep is going to be disturbed, because diuretics normally increase the outflow of water, so there's the tendency for you to always go to urinate. So we tell them, instead of you taking this in the evening, why don't you take it in the morning, so that whatever peeing you want to pee, whatever urination you want to do, you do it throughout the whole day before you sleep. Then there are some people, it's not even an issue of urination, it is insomnia. There are some medications that you can prescribe, for them. Bromazepam is one of them. Nitrazepam is also another one, depending on whatever the physician has observed with respect to the patient. But one other thing also about libido is that because a person has hypertension, and the person has some issues with libido, for someone that has that, what you want to do is whatever sexual enhancing product you want to give, you make sure it's not something that is going to counteract the effect of the heart, because most of them in some cases they increase the heart rate, and what you're trying to do is to reduce the heart rate to normal, so that you don't have hypertensive crisis. So in the case of trying to now manage libido, you don't want to complicate the life of that particular individual. So a lot of some people come down with nausea and vomiting. Some people even talk about rashes, so you just take it on a day by day basis. Now, I talked the other time about exercises as part of the lifestyle management of hypertension. When exercises are started, the first few weeks you're going to feel some pains.
Yes.
It's a normal phenomenon, but your physiotherapist will tell you that even as you're feeling the pains, after a while you're going to overcome it. Physiotherapists know the best type of exercises to prescribe for the person. We talked about brisk walking, we talked about swimming, and then we talked about cycling for those that are able to cycle. But anybody that is probably 60 years and above, we usually prescribe that they should just walk 30 minutes. So I think those are the few I think I can just quickly juggle up with for now.
Okay, thank you very much for this wonderful section. I would say that you should share this to your friends and family. Let us save one person. Hypertension can be managed, and it is a lifelong management. Like our doctor said, not that you take it and because your blood pressure has gone down, then you just stop it and go back to the lifestyle you
were before.
Please, and on lighter note, those of you that take like it to in fact you point to all those things, it has a negative side effect as taking the enjoyment aside, there is the negative side. So let us do everything moderately. So we would have to stop here, and no, the series is not stopping, but on our next episode, we are also bringing in another health practitioner. So you wouldn't want to miss that. And I have a lot that I've written down here, but on our next episode, we'll quickly go over it, or go over them, then we'll continue. So we'll have to draw the curtain here, and we're saying a big thank you to our doctor for joining us on this episode. We appreciate you, sir.
Thank you so much. Thank you for having me.
And so I remain your host, Ajayi Adenike. Please have your blood pressure checked and drop your questions in the comment section below. We'll be there. Thank you.